done. That's
fine.
the net of that advice. Hi, I'm Michele Grazulis, and I'm president of the foundations at Rochester Regional Health, and I'm here today and joined by two wonderful people. I want to introduce them. This is Dr. Anja Bottler, who is an infectious disease specialist at Rochester Regional Health, and Sherika Hall, who is a learning and development trainer at Rochester Regional Health. And we're here today to talk about Pride. As hopefully most of you know, this is Pride Week in Rochester. And this is the first year that Rochester Regional Health is participating in the Pride Parade, and we'll get to that in just a second. If you're listening and you have questions, please send them in, and we'll take a break and ask those questions as we move through our conversation. But first and foremost, thank you for being here with me today. It's great to have you here.
Thanks for inviting us.
So this is the first time Rochester Regional Health has participated in the Pride Parade, and this is pretty significant as the second largest employer in Monroe County. I think the fact that we have so many people coming together this weekend to celebrate Pride is amazing. So let's first start with how many people are coming. I think Sherika, you know how many people we have signed up, right?
200 plus.
Yeah.
200 plus people are going to be participating, which is huge.
Talk a little bit about the Pride Parade.
Pride Parade is really significant in Rochester. It's just a big time for everyone to come together. People who don't really express themselves so much, this is just their time, this is their week. It's actually the month, because Rochester does so many different things. But really the 200 plus people for us marching for the first time, it's really a big deal to show that presence, because like you said, the second largest employer, that kind of presence should be felt. It's a chance to give people time to really express themselves and who they are and be comfortable out in public, where some people are not because they have to hide. But during Pride, it's just, you feel prideful. It's just the best way to say it.
You get to show your pride,
Yes.
which is great. So and we'll talk a little bit more about what's going to happen that day and a little bit about what Pride means to the three of us. But I think I want to also talk a little bit about what we're doing as a healthcare organization as it relates to Pride. So Dr. Bottler, I'm going to talk a little bit about your role in infectious disease and what we do to particularly speak to the LGBTQ community.
Correct. So the Infectious Disease Clinic was founded in the mid-90s, and at the time, HIV affected disproportionately gay men. And so that was the start of the clinic. And over the years, we have expanded the clinic to many other services, obviously. And for the last several years, we have especially incorporated prevention services like PrEP to patients at risk for HIV. And again, we know that HIV still affects disproportionately black men who have sex with men. And that's a big focus for us to offer the information that our clinic is available to service patients and treat infections as well as for prevention as well.
And so one of the things that I'm really excited about is we're going to have a booth at the festival that occurs after the parade, where we will be providing information to the community. So in case anyone wants to learn more about that.
Correct. So we have the booth staffed with nurses. I will be there for some period of time, and we will be giving out information about what services we offer in our clinic, how to reach us, how to access us.
And I think it's vitally important as well for people to know that that's there, because Sherika, as you said, for a lot of people, they may remain closeted in other aspects of their life, but this is an opportunity to not only be with people that they feel comfortable with, but then also get information that's vital to their health.
Yes.
Yeah. So in addition to that, I do want to mention also, we're going to have the sign-up availability for the mobile mammography unit. So I don't know if either one of you are familiar with what that is, but for those who are listening who might not know, we have a mobile mammography unit that travels around the city that provides free mammograms for people at various locations. And while we couldn't have the bus there, we will have a sign-up, so that will also be at the booth. So that's really exciting. Anything else that you would want to comment on relative to what you do and the impact of that to the LGBT community? I just want to make sure we don't miss anything.
Well, it's treatment that we offer to patients, and we try to be very inclusive. So when patients come to our office, we ask them for their preferred name. We make sure we address them with the right pronouns. We make mistakes at that, but we try our best to do that. There's a lot of perceived or true discrimination towards the LGBTQ community, and we try to have that not affect our work in our office and be able to give patients the desired help or treatment that they need.
In an environment that feels respectful to them.
Correct.
Which is really important. So we talked about the significance of 200 people, Sherika, you mentioned that. What does it mean to you to know that Rochester Regional Health promotes inclusivity?
What it means is just more a comfortable place to work where you feel included, you don't feel discriminated against. Diversity is big here. And just also as a trainer, you know, people have been asking me more about my pronouns. And that feels really good. You know,
Yeah.
I use she, her, and hers. And some people are like, oh, okay. And it's just really good that people are thinking that way to make sure they're not being disrespectful or judgmental. So that feels great. I love that feeling. And just really just, how do I say this? Just more of a respect.
Yeah.
Feeling respected at work, that you can be yourself, that you can express yourself, that you can talk about your significant other and, you know, no one's judging you or looking at you funny. You know, what you do this weekend? Well, you know, I did X, Y, and Z with my wife, where it's not just someone being taken back by it. And that's really comfortable. And just being a trainer, working with different people, talking to them, seeing their walks of life, and just really, and some people have also come out to me and let me know that, you know, they were LGBTQ identified. And I think that's huge, to just have our own community within the organization.
Yeah.
And just being at Pride shows that Rochester Regional is listening, and they really want to be there to support their employees and just give people a time and place and voice.
Yeah. Well said. Dr. Butler, any thoughts on that?
Yes, I have to totally agree with this. I think LGBTQ is in every other community as well. So it's within your work community, it's within your church community, on your soccer team or so. So patients or people are very inclusive, and they're everywhere, and they deserve the right health care, and they deserve to be addressed by the name that they prefer, by the pronouns that they prefer. And we do the best we can. Things change, so we always have to reinforce that and ask patients over and over, because things might change. But as long as we try, or we have the effort and be an ally in addressing patients appropriately, I think that builds a bridge very early on in the conversation and delivers appropriate health care.
Well, and I think it just reinforces what I think our approach has been, built for the community by the community, and the community is a very diverse community,
Right.
So our ability to care for the diversity in our community is of vital importance. So I want to talk about straight allies and the importance of having straight allies at work. So Sherika, I'm going to ask you the question. Can you articulate for folks listening why having allies is so important?
For inclusivity, just to be inclusive with everything, and you don't feel like, you want to feel like everyone's together, and it's hard to feel that way if you're not being supported by those who aren't part of the community.
Mm-hmm.
And just to have those people at work, like in your corner, being your voice along with you, shows that people are, you know, they're here for you, and they really just have that level of support in all different levels at work.
Yeah, I think if I could speak for myself for a moment, I think that it also, having straight allies means that the ability to have those types of conversations that anybody comes to work who may be in a heterosexual relationship has on a daily basis, those straight allies make it okay to have those types of conversations.
Yes.
Because it just becomes part of the normal conversations that take place at work, which is comforting for those of us in the LGBT community, I think. So.
I definitely agree with that.
So let's talk a little bit more about Saturday and what's happening on Saturday. So the parade starts at, we've been having a debate about this before we went live, but the parade starts at
1 o'clock.
1 o'clock on Park Avenue, and it travels down Park Avenue and ends up at Cobb's Hill.
Yep, ends at Culver, then you walk over to Cobb's Hill, so that area.
And then at Cobb's Hill Park, there is the festival Saturday and Sunday.
Yes.
But the booth that we're providing there is on Saturday, or is it both days?
It's both days.
Both days, okay. So we'll be there both days, and folks from the infectious disease group will be there
Yep.
as well. And as I said, mobile mammography. So if you are interested in getting involved and want to walk as a straight ally or just a member of the Rochester Regional Health community, we encourage you to do so. I'm going to actually put Christina on the spot for a quick second. If people are still interested in signing up, what's the best way for them to do that?
They can go to theoutalliance.org.
Okay, so go to outalliance.org and you can still sign up for the parade, and the website, Phil's telling me the website's below on the screen. And while I'm pausing and punting for a moment, Phil, any questions that have come in?
Everyone's excited to be doing it.
That's great, that's great. So those of us from Rochester Regional Health will be lining up at noon to walk in the parade. And as Sherika said, the parade starts at 1 o'clock. So I want to pause by asking us each to provide a reflection on what pride means to each one of us. So Dr. Butler, I'm going to start with you. If you just tell people, what does the word pride mean to you?
Well, it means to me inclusivity, because your neighbor can be part of the LGBTQ community, and you don't know that. And and at work you want to include everybody, and in your social life you want to be inclusive. I think that opens lots of doors. It gets you a lot of exposure. It gets you new ideas, and it just can broaden your horizon. I think it's very important to do that.
Yeah, I agree. Sherika?
Pride. Pride to me is just happy. It's just a happy time, just people are coming together, expressing themselves. We have so many different festivals in Rochester where people can identify with who they are, and it's great that there's a big one here for those who identify LGBTQ to be able to have that same kind of experience. So pride to me is just really what it means. It's just joy, it's happiness, and able to express yourself and be who you are. We try to encourage at any time, but during this time especially, these 2 weeks to really express yourself and enjoy that and love that.
Well said. I think for me, I think pride is a time to feel that pride, but I also think, and I think about it as it relates to work, I'm proud of who we work for because I feel accepted and valued and respected when I come to work every day for being who I am. And I like that we're creating a culture here that creates that sense of pride in the many ways that we're different. There's 17,000 plus of us, and each one of us brings something different to the equation. And so I feel a sense of pride in working for an organization that values that. So that's what I think of when I think of pride. So, okay, so we look forward to seeing all of you at Pride. So I look forward to seeing you guys at Pride on Saturday. And I want to thank everybody for listening, but I also want to thank the folks behind the scenes who made this happen. It's no small effort that for the first time we're participating, and it's huge, I think, for the community as well as our employee population to see it, but there's a whole bunch of folks behind the scenes who will go unheralded for their efforts to make it a reality. But my hat's off to all of you, and I'm excited to see everybody on Saturday. Again, if you have any other questions for follow-up, please send them in and we'll get back to you. And thank you both for being with me today. Have a great day,
Oh,
and
thank you.
happy Pride.
Happy Pride,
Happy
indeed.
Pride.
Happy Pride.
Happy Pride.